It's hard not to worry when your child is sick with diarrhea. Hi, I'm Dr. Beth, and I'm a pediatrician at SickKids. Let's talk about 5 important things that can help you care for your child when they're sick. What is diarrhea? Diarrhea is the word we use to describe poops that are both more frequent and more watery or loose than usual, and it happens very commonly in children. Diarrhea can have many causes, but by far the most common reason that children get diarrhea is a viral infection. Viral gastroenteritis, stomach flu, or stomach bug are also all used to describe diarrhea caused by a virus. There are many viruses that can cause diarrhea, and they are very contagious. Because of that, children can experience more than one infection with diarrhea in a single year. Children with viral gastroenteritis can also have fever, abdominal pain, and vomiting, along with diarrhea. Most children get better within a week, but sometimes the diarrhea can take a little longer to completely go away. There are other less common causes of diarrhea. Sometimes bacteria or parasites can cause it, and sometimes children can experience diarrhea due to conditions that are not infections, such as a side effect of taking antibiotics. Since viral infections are the most common cause of diarrhea, what should you watch out for and what can you do? 1. Dehydration. When children have watery diarrhea, they lose fluid from their bodies and can become dehydrated. Children who are dehydrated may have a dry mouth or tongue, no tears when they cry, sunken eyes, more thirst, fewer pees or wet diapers than normal, a sunken fontanelle or soft spot at the top of the head in babies, lower energy levels, sleepiness, or irritability. 2. Fluids and feeding. The most important treatment for children with viral gastroenteritis is ensuring they are drinking enough to prevent dehydration. Breastfed babies can continue breastfeeding, and formula-fed babies can continue drinking their regular formula. For toddlers and children, other good fluid choices include oral rehydration solutions and apple juice diluted half and half with water. Full-strength juices may worsen diarrhea, and water alone is not recommended if children are not drinking or eating anything else. How much should your child be drinking? A general rule is to encourage your child to drink enough fluid to prevent the signs of dehydration. Children who have an appetite and are not vomiting are encouraged to continue to eat whatever they like. There are no specific food restrictions when children have viral gastroenteritis. 3. Diaper rash. Diarrhea can be very irritating to the skin in the diaper area. Apply barrier ointments to your child's skin to reduce rash. Use ointments that contain zinc. Clean your child's skin immediately after each bowel movement. Then apply a very thick layer of protective ointment. 4. Hand washing. Because viral gastroenteritis is easily spread from person to person, remember to wash your and your child's hands with soap and water after every bathroom trip or diaper change. 5. No medications. There are no proven safe and effective over-the-counter or prescription medications for diarrhea caused by viral gastroenteritis. Some medications may cause side effects, and some may be unsafe for children. If your child has a fever, you can use fever medications such as acetaminophen or ibuprofen. Many parents ask about probiotics when their child has diarrhea. There has not been enough research that proves probiotics make children with viral gastroenteritis better faster. When to seek medical care. The 2 most common reasons to have your child seen by a healthcare provider are dehydration or because they have symptoms that may point to something other than viral gastroenteritis. Take your child with diarrhea for medical care if they are less than 3 months of age or they're showing signs of dehydration and are not able to drink fluids. Some children, especially infants, may need fluids in an IV to treat dehydration. Or they have any of the following symptoms that are not common with viral gastroenteritis and may point to another cause. The diarrhea is bloody or has mucus. There is vomit that is green or bloody. They have abdominal pain that is getting worse and is not relieved after a poop. The diarrhea has lasted for more than 2 weeks. I hope you found this video helpful. Subscribe and visit AboutKidsHealth.ca for more. Thanks for watching. Stay healthy, everyone.